Hello friends, let's revise surgery quickly. Distributive shock, and it can be septic shock, anaphylactic, neurogenic, and all of them will have increased mixed venous saturation, and septic and anaphylactic increased cardiac output it is seen, except neurogenic shock, which shows cardiac output is decreased. Next one, TPN, total parental nutrition, it lacks fiber. Next one, subungual melanoma, one of the character is Hutchinson's sign, so this is the Hutchinson sign. Okay, and it can be present in great toe and thumb, and most of the literature says this is one of feature of acral lentiginous melanoma. Next one, Jackson zone of tissue injury, so it has 3 zone post burn, okay, immediately during burn. So middle one is a zone of coagulation, so maximum injury is seen here. It is severely burned injury, and just around this there is the zone of stasis. This is due to vasoconstriction, and most periphery is the zone of hyperemia, and this heals with minimum or no scarring. So outermost this zone of hyperemia, only this zone hyperemia, this heals with minimum or no scarring, periphery only. Next one, so maximum inhibition effect of steroid on wound healing is seen on inflammatory phase of wound healing. So steroid, what will affect? It will inhibit angiogenesis, neutrophil migration, macrophil migrations, and fibroblast proliferations. Okay, so steroid will inhibit angiogenesis, neutrophil migration, macrophage migration, and fibroblast proliferation. Next one, vitamin A topically, if we apply on wound, it improve epithelialization, so vitamin E has a good role. Okay, next one, most common cause of skin graft failure is due to hematoma. Next one, subclavian steal syndrome, so this photograph is showing subclavian steal syndrome. So what is here is the subclavian artery stenosis. So what will happen? So blood will not ascend upward, and brain blood will come down to this one because of low pressure, and then go to periphery. So this is the steal syndrome, subclavial steal syndrome. So it steals some part of blood from brain, that's why it is known as subclavian steal syndrome. And let's see one of clinical vignette. 40-year patient complained of a recurrent episode of syncope and cramping pain of left arm whenever he played badminton. So this, and the angiography is showing the stenosis of first part of subclavian artery. So this is known as subclavian steal syndrome. And returning of blood from brain is causing cerebral ischemia. So we have next one, 3 images. Here is the chronic venous disease, 3 conditions. Here is the atrophy blanche, we see whitening of skin here. Here's the atrophia blanche. Now this, what is this? Here we see somewhat inverted champagne bottle like appearance. This is lipodermatosclerosis. And both of these conditions on CF classification. CF, what is this? Clinical etiology, anatomy and pathophysiology. This classification, this falls under C4b. Okay, what is this one? Again, this is the corona flea bacteria, and it falls under C4c. It is somewhat more advanced than these two one. Okay. Massive hematosis, what is its definition? More than 600 ml of blood in 24 hours, or more than 150 ml of blood per hour that is filling anatomical dead space. And what is the source of bleeding? Pulmonary artery. So next clinical vignette is showing the 60-year male patient has a unilateral this hard palate these lesions, and the histopathological slide is showing this one Swiss cheese pattern, and this is the diagnostic for the adenoid cystic carcinoma, and it is associated with perineural invasion, and this is slow growing tumor, and the tubular type is best prognosis, but solid type is the worst prognosis in a solid type. And if distant metastasis happens, this goes to lung. Next one, hypercontractile esophagus, also known as Nutcracker esophagus. Here the peristalsis is normal. What is diffuse esophageal spasm? Here also peristalsis is intermittently normal. Peristalsis is normal. And DES, diffuse esophageal spasm, it's often triggered by cold food that may cause chest pain and dysphagia. Next one, early gastric cancer, it involves mucosa and submucosa, or it has muscularis mucosa and lymph node. And here we use Japanese classification for early gastric cancer. So next image is showing this reddish I have shown. So in this is what high selective Vagaotomy. This is used for the treatment of ulceration caused by high acid. So this is recurrent ulceration still post high selective Vagaotomy. Recurrent ulceration is there is a chance 2 to 10% is still chance of post high selective Vagaotomy. So one of the clinical vignette saying is adult male has underwent this abdominal aortic abdominal aneurysm repair surgery, and on second day of operation, patient has acute pain and guarding is present. This is due to what? More probably ischemic colitis at this place. This is the splenic flexure, also known as Griffith point. This is between superior mesenteric artery and inferior mesenteric artery zone, watershed area. Next, so start screening by mammography when this is recommended by age 40 years. Next one, what is this? Here we see two bowel loop is herniating through this abdomen, this hernia, and the two bowel loop is inside this sac. This is medial hernia, also known as hernia in W or retrograde hernia or sorry for discontinuation. Let's continue. This is also known as this is a middle hernia. Two bowel loop is inside sac, and connecting part of these two loop is inside abdomen cavity. So this is hernia in W, or also known as retrograde hernia. Retrograde hernia. This is the colonoscopy, and this is showing this is small polyp, very small polyp, and this is what rectosigmoid at, this is at rectosigmoid region. This is the hyperplastic polyp, and this is most common type of colorectal polyp, hyperplastic polyp. It is seen at 6th to 7th decade, and histopath is showing this elongated crypt with sawtooth or star-shaped appearance. Next one. So what is this? Various incision on abdomen and chest. So we will see only few. So what is this? A, this one, yeah, this is the lange one. Later hua, lange one is A. What is this? B, it is going upward, it is going upward. This is gridiron, this is B. Okay, what is this? C, C is the battle is C. And what is D? D is the Rutherford-Morrison incision. So Rutherford-Morrison. So here gridiron incision, this is muscle is splitting incision, and Rutherford-Morrison, what is this? This is muscle cutting incision. Muscle is cut here. Okay, next one. So this is full wall herniation. This is the Meckel's diverticulum. This is due to the failure of vitelline duct regression. This is true diverticulum because of all wall layer is protruded together. This is congenitals, and this is at anti-mesenteric border of ileum. If what is the treatment? If it is narrow mouth and thick, resection is preferred. If it is a wide mouth, then it can be left alone, and conservative treatment is given. So what is the rule of 2 here in Meckel's diverticulum? Here prevalence is 2%, male to female ratio 2:1, location is 2 feet proximal to ileocecal valve, length is 2 centimeter, and in the symptoms, half of the symptomatic patient appears within 2 years. Within 2 years of age. Okay, next one. So what is this? Rectal prolapse we see, and this procedure is a Delorme procedure. Here the interrupted suture is given. Next one. So lymphoma, for lymphoma chemotherapy ABVD is used. This regimen is used. For non-Hodgkin lymphoma, R-CHOP regimen is used. For advanced bladder cancer, MVAC is used. For rectal carcinoma chemotherapy, FOLFOX regimen is used. Next one, Cullen sign and Gray Turner sign. Both of them are due to hemiperitoneum, but both of them are rare finding in acute pancreatitis. Cullen sign is periumbilical bruising, but Gray Turner sign is at flank. Next one, 4 Ds of gluconoma. It is diabetes mellitus, but it should be without DKA, dermatitis, DVT, and depuration. Next one, this is the dilated clubbed calyces and ureteropelvic junction stricture is seen. At ureteropelvic junction, stricture is seen. So this is the hydronephrosis, and what we can perform renal isotope scan can be DTPA or Mark III. So renal isotope scan is performed for obstructive dilatation pathology of collecting system. Next one. So we see this histopath. This is plant cell like histopathology is given here. This is the chromophobe type of renal cell carcinoma. Here the what happens, multiple losses of entire chromosomes, chromosome 1, 2, 6, 10 and 13 is seen, and extreme hypodiploidy is seen here. So but it has best prognosis among all other RCC, and it originates from intercalated cells of collecting duct, intercalated cells of collecting duct, and it is also associated with Berg-Hooge-Dube syndrome, Berg-Hooge-Dube syndrome. And in immunohistochemistry, cytokeratin is positive. Next one, Intravezical Bcg therapy is what is used here. Attenuated strain of M. bovis is used. Attenuated strain of M. bovis is used. Next one, in BPH, what is from where BPH arise? Benign prostatic hyperplasia. Hyperplasia arise from transition zone, and prostatic carcinoma arise from peripheral zone. Gleason score, it correspond to pathological staging, and from 6 to 10, 6 shows 6 indicate low risk and 10 high risk. But PSA, prostate antigen, this specific antigen, it is neither specific or nor sensitive. Management of hypoespedia, we do not do circumcision. Circumcision is not done. Why? Foreskin can be used for reconstruction, that's why circumcision is not done. So what is this? Next and last image. Here it is a multilocular cyst is shown on trans illumination of scrotum. So this is epididymal cyst, but if on trans illumination only unilocular is seen, that is a spermatocele. So multilocular epididymal cyst, unilocular spermatocele. So friend, thank you very much. Please like and subscribe my channel.